Good afternoon, everyone. I'm Dr. Pratik Neupane. Thank you for having me here in your program. I'm here to give you some idea about a doctor's perspective, not just treating a patient, but also about managing things. Probably the audience is mostly of management background, and I would like to elaborate it somehow and my topic with beyond the stethoscope. You can imagine me as a doctor wearing a white coat and obviously an stethoscope. I will shorten it with steth, we usually say it. What you imagine is I have a tool, a steth on my white coat, and I have that tool, and that is everything, that I can identify everything. What if I share today that is not the everything? That's my verdict today. And I practice it daily. And that complexity I bear every day with my patients is not simplified just by an stethoscope. So, what's the norm of a doctor? What's the normal? A patient comes in my OPD and he or she says his history, his complaints, and all the elaborate things. That's my OPD, but not my ER. In ER, maybe somebody is already dead right coming in ER, or in grieving pain that you can't imagine. Maybe some of us have landed in emergency that way. And in that case, he or she can't explain her symptoms also. Now, how do I listen everything? Then I examine the patient. That's the norm. I examine it and I listen through my stethoscope. Now only in the third and fourth step that stethoscope comes in my examination. And then I go for management. Maybe it's emergency management, or I send for an investigation, or I start treating immediately. That's the norm. And I explain the prognosis, complications. That's the way. But that's the normal, that's the template. But again, I say repeatedly, because that's the usual thing, that's the straightforward way. There is a different way also. Because maybe some cannot explain his or her symptoms. Maybe she is comatose. Maybe she is in great pain that she can't explain all the symptoms. Imagine a patient of road traffic accident that comes in ER, emergency room, and says that he has pain in leg. Now, do I treat the pain in leg first or examine the other things? My first purpose is to see if he or she is in danger or not, life-threatening conditions. So, maybe I can't determine if somebody asks, is he or she is in danger or not. I have to see, I have to wait. She can't explain all the things. Maybe she has some other illnesses also, comorbid we say. That accident one, the patient, maybe she has or he has a heart disease previously, or kidney disease also, maybe, or other diseases that can make that incident more fatal. Maybe he or she has missed his or her medicines also from the day before, rescued. Maybe some elderly people I usually encounter in my OPD, they take one medicine in the way that they were taking the other medicine. That means they are missing some kind of medicine and taking another medicine doubling. because in every strips of the medicine, they cannot read or read that thing, or they cannot read the written prescription. How many times they are to be taken it. So, in so much of uncertainty, the certainty is not the way that I can fix everything at the first encounter. Now, here the textbook ends. There might be other challenges also, like grieving families. A patient is admitted in ICU, and the family, the visitors we usually see, they come with all the griefs that will my patient, will my father, mother, a brother, sister, a son, a daughter will be okay? In how many days will he or she be okay? Maybe before landing or at the time of landing in emergency or ICU, the patient is already dead, flat. We can't explain. Like leading to the crisis is the crisis is the most important. I previously said there can be so many type of crises, like road traffic accident. So many people are already there. The emergency is full packed with accident cases, or the emergency is full packed and the patient is directly transferred to ICU. Some kind of ventilation is needed. And real-time scenario is the most difficult time. Like somebody comes with a kind of chest pain. Maybe he has some heart attack. And we have sent for the labs. The labs take time to give the results. And still we have to wait. And we can't tell that he or she has the disease, that specific disease. We just say it provisional diagnosis at the time. And we have so many provisional diagnoses that which to treat first. And in that uncertainty, we use everything we have in sources. Like, again a case, a patient came, fall injury. He fell down from 2-story building, right 1 hour before, and people transferred in an ambulance to emergency. We see the vitals first, but before that, is he breathing? Is he awake? How many things are there? We have a template. We have a template to see everything, but still, there are so many things that we cannot explain all the time. And first time, there was ABCs introduced in our basic life support training. But before that, we introduced a cervical collar later. Because if his neck is broken, then he or she will live for his whole life. But what happens is he will be paralyzed from below, like. And what is the quality of life? Now we have to think primarily for the quality of life. So, in such case, we are always in doubt. Now, does that mean that our stethoscope is working there? No. We have a silent stethoscope. The point is, that's our inner instinct. That's our experience that holds. That's where we navigate the things. We navigate it deeply. We don't feel crisis. We don't feel in a hurry, but still, you can't show the hurry, but you must be in a hurry. Every seconds count for life. Every seconds means a heart for a heart attack. Every seconds means brains and nerves for brain stroke. And every second means a limb for a disease. We usually say PAD. So here still that silent stethoscope is always working for that uncertainty. And so with my experience, I say the uncertainty is the norm. Every individual has a different way of telling his or her things. Every individual cannot express everything. And every individual might not want to say everything. And in all that uncertainty, we make a verdict. This is the most dangerous. This is the least dangerous. And this might be dangerous at a point of time. And accepting the uncertainty as the way we treat or manage the people, we have been through such a kind of problem recently as a pandemic. That was the COVID-19. It was new to us. We didn't know anything about it. We didn't know how to treat it. And every hour, every day, the protocol was changing. How do we treat? Is it better? Is it the best way? And listening to the internet, where we can find a good result. That pandemic taught us so many things that the panic from the pandemic was more dangerous than the pandemic itself. And a new disease can create such a havoc that every country in the world would be unstable, fragile with panic. So we learned so many things. We were not just doctors at that time. And what true tools was looking at us, was with us, that it was the presence. We missed the presence because we feared. We panicked for the gear. We didn't have the gear. We call it PPE. You might have listened it. So at that point of time, we had the presence that we didn't start our hospitals. We didn't start our clinics. And we continued our treatment. Only the disease pandemic, COVID was new, but everything was still going on. A diseased person before him was still with the disease. And the poise, I tell it, that we were not tensed. We were not panicked. Maybe we panicked, but we were with us, that we didn't leave our jobs. We had the fear of dying of COVID, because so many people in the world were dying, in even the first world countries. And then there is the perspective. We had a template to how treat a pneumonia after COVID or any other disease. But still, at a point of time, we introduced our own type of treatment protocols. We had our own perspective. Beyond the world has given anything as a perspective. They were still confused. We were also still confused, but we made a way out. And there was so little death in Nepal that we can barely count it in the lowest mortality cases country. So we were happy with that, with our perspective here. So I would like to say, whether you are a doctor, I would like to join you here. Whether you are a doctor or a manager or a student or any parents. First, power that you have in your hands to make a difference doesn't really lies from your knowledge only. It is the point where you embody everything, every way, every possible ways, and make that uncertainty, that darkness that you can't decide at that point, make clear, or you segregate the dangerous and the least dangerous. That's the way a good manager, maybe a business or anything else, can run. You might get into any kind of problems in your life. Everything will not be predictable. Everything is not certain. So many businesses are stopped in the mid because there are so many problems that you cannot anticipate. And even with your highest of the knowledge and anticipation, still there is another big fish in the ocean. And you cannot avoid it. So your business or your ideas might be getting down, getting low. Before that, you don't panic first. You go with your ideas. You put on more ideas. You get better with your problem solving ideas. Only then you will make a future. You will make a way, and you will be at a position that you can really feel happy of what you did beyond all the difficulties. Thank you for this.